Hi. Hello, everybody. Welcome to Knock Knock Hi with the Glockenfleckens. I am your host, Dr. Glockenflecken.
I am your host, Lady Glockenflecken, Preston Flannery.
And Will Flannery. Thank you so much for joining us today. We've got a very special, fun guest, a fellow doctor, social media content creator.
Correct. Comedian.
Preston Roche. He goes by Press Row on TikTok and Instagram and YouTube and the social media platforms. That's where he is. And I tell you, like, this guy, like, people are in healthcare, like, they like his stuff. He's got great content. It's informative. It's funny. It's just, I love what he's doing. And then we actually reached out to him and was like, hey, we got to get a podcast going for you. And so our team has been hard at work with him to try to define what it is this podcast is, and it's really coming together. It's going to be really good. So he's going to talk a little bit about that at the end, and then just some great stories about what it means to be a content creator as a resident and med student, and what kind of trouble you can get into.
The ever-present professionalism debate.
Yes, absolutely. Speaking of trouble, I didn't get in trouble, but I did do a thing that's, I think a lot of people can relate to. I walked across the red line in the operating room without my bouffant hat on.
Uh-oh. Did an alarm go off, or the police come to get you?
I had a nurse that goes, oh, hey, hat. I was like, oh, I'm so sorry. I put my head on my hand. I was like trying to use my hand
as
a makeshift hat as I scampered back across the...
Just hold all this hair on here real quick.
Hold it all in here.
Till I can get to my bouffant.
And then I went and got my little stupid looking bouffant cap. And
that's a rookie mistake. That's interesting.
It's a rookie mistake. I don't know. I wasn't thinking. Yeah. I was just going about my thing.
I would think by now it's just a habit.
Well, it normally is, but I don't go to this hospital I was operating at very often. So I was like, I have a routine, but it's not as frequent. It's like once a month I go over there.
Yeah.
But the point is, like, I still make that stupid mistake that
That's why there's all the checks in there.
I remember making as a med student, third-year med student. I did the same exact thing. So some of us are better at learning from our mistakes than others. But it was just kind of funny. It was like, oh, some things never change.
Yeah.
And the nurse, hat.
Well, good thing she's looking out for the sterile field.
Well, exactly. And that's the reason, for those of you not in medicine, it's like there's this point of no return, not no return, but this point in the operating room where you have to have your hair covered before you go past that point, because you're getting into more of the sterile area.
Yes.
The hallway is not sterile, but we want to try to keep it as clean as possible. And that includes not spreading your hair fibers and
don't want those ending up in a patient.
You don't want those wafting into an operating room when the doors open and stuff like that. So anyway.
Well,
there you go.
I hope you learned your lesson.
I did, although I'll probably do it again in a few months. No, that's okay. It's not like a fatal error.
Yeah.
It's like I was like 4 feet over the line, and then I kind of scampered back, holding my head on my hands.
Yeah. Do you think 4 feet is like one step for you?
4 feet, yeah. That's about one step.
Yeah.
They caught me quick.
They did.
I would have caught myself though, like.
Would you? How far would you have gotten?
Like 1 or 2 more seconds, and I would have been like, "Oh man, I don't have my hat on." I would have figured it out, but they caught me before.
Would it have
I
felt weird
myself.
to like be in the sterile field without? That on, like something would have felt funny to you.
I would never have gone actually into the operating room without my hat on.
Yeah,
it was outside in the hallway.
Oh, the red line's in the hallway.
Yeah, it's in the hallway, so it's not even in the operating room. It's like,
gotcha.
Anyway,
see, that's why all those things are there.
That's right. Last thing. Speaking of stories, like the one I just told, hey, if you guys have, we're looking for more medical stories. You know, we like to tell stories sent in by our listeners, and so just your periodic reminder: send us some of the funny, weird, interesting, embarrassing. We love embarrassing stories on this podcast from your time, either as a patient or if you're a healthcare professional. in the course of your job. We know you guys have the stories. You're full of them. All right. There's so many things that happen in your line of work, or in your experience as a patient. Let us know about it. We want to hear it. knockknockhigh@human-content.com. All right. Should we get to Preston?
Yes.
Here we go. Dr. Preston Roche. Today's episode is brought to you by the DAX Copilot from Microsoft. To learn about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knockknockhigh. Again, that's aka.ms/knockknockhigh. All right, we are here with the one and only Preston Roche, one of my favorite medical content creators out there right now. Doctor, thank you so much for joining us.
Oh, well, it's a pleasure to be here. Thank you.
So I think this is special because you, I think, are the closest to intern year for a guest that we've had.
Is that right?
I think it might be. Yeah. I don't know if we've had a med student on. Maybe. But anyway, the point is, Preston, you just finished, right? I mean, congratulations.
1 month removed. Thank you.
Exactly how easy was it?
It was the hardest thing I ever did in my life. So
negative easy.
Yeah.
Well, I want to set the stage here for everyone. Preston, I'm just admiring your background. Is this the office you put together? Because I saw that video on TikTok. Where you were putting together. So
that was my therapy office that I put together. This is my home office where I guess I therapize myself, or Maggie, my cat, therapizes me. But I care a lot about lighting, so a lot of this inspired how I wanted my office at work to look.
Okay.
Did you copy our yellow chair? We just have to address the elephant in the room.
Oh, yeah, we both have a yellow chair.
So I got the yellow chair before I even started making content. So okay. I think it's just a sign.
But was it before we started making content?
It wasn't before you started making content, though. So I wonder if the idea just came to me and I subconsciously bought the yellow chair, and now I'm just resisting that.
Who knows? I mean, you guys are very similar. It would not surprise me. Like, for him to say you're his favorite medical, like that, I can vouch for that. That's like...
I'm a bit picky.
He's so picky. So for him to even say that he is like... sort of funny, right? Would be like high praise.
Okay, so...
And for you, he's like, no, this guy's hilarious. I love his stuff.
Absolutely. It's refreshing and funny. So for those of you, I mean, we're going to give you... We recorded an intro already for you. And but for those of you who may not be familiar with your content, like how I found you were these skits you were doing about healthcare, about medicine, with like this comedy troupe of people. I don't know. It's just, and everybody was so good. Whoever was filming is so good. It just came together so well. And I was like hooked immediately. I was like, oh my God, this is fantastic. It definitely, I could tell you were all fourth year med students, because how on earth would you have the time to do all of these props?
If they were not ophthalmologists.
Exactly. Right. Yes. Exactly. And so can you just talk about the genesis of your TikTok platform?
Yeah, sure. So weirdly enough, I started it in October of my fourth year as totally a lifting platform. I was like, I'm going to be on Gym Talk. I'm just going to get jacked. And like, I got my personal training certificate, and I was like working at F45, and I had a whole plan to be like a personal trainer. And I was like, oh, I can do like social media for this too. And I made
this was during med school?
This is fourth year med school after I was just waiting for interviews and stuff. So everyone's, you're supposed to get your hobby, right?
Yeah.
And mine was just to be a Gym Talk influencer. I was like, it's perfect. So I made the account at I think like midnight. It was like 12:30, and I was like, I should do social media. And then I was like, what should I call myself? I'm like, first name's Preston, last name's Roche, like Presro, perfect. I really should have thought more about it. Creative, but then by the time I was like, wait, I need a good name, and it already stuck. So here we are.
You are preaching to the choir.
You're talking to someone who named himself Glockenflecken. I mean, yes. Come on, we could all choose better names.
Yeah, it's hard out here. So anyways, I really liked the idea of being like a med student during the day, and then my Batman costume was like being a gym talk influencer at night and just doing all this superficial stuff. And then I just found that there was like nothing to make content about. It was like, ooh, like me lift heavy, and then like,
Right.
and then steroids were bad, and then some people were like, well, steroids are actually good, and I'm like, I can't like in any way condone this behavior. Like, there's this like subsection of the internet where these lifters will be taking a bunch of steroids, and then they'll be like posting about their symptoms. Like, guys, like I'm hearing voices at night. Does that happen to you guys when you take like Anavar? And everyone's like, yeah, bro, like same thing. And I'm like sitting here in the comments, like reading about this substance abuse psychosis. Like, please, guys.
Oh my God.
Like, stop.
I was just saying, I thought that there's still a way you could go with gym talk, but just the self-analyzing all the little decisions that you make, and kind of really leaning into the comedy aspects of that, I think could be something there.
I just found it was harder to tell a story, I think.
Sure.
And all my stories came from my experience as a med student. So actually, I'm a military. I was HBSP, so I matched in December. And after I matched, I talked to my friend Daniel, who me and him had started a meme page really early on in med school. And I was like, hey, do you want to make some sketch videos with me with med school content? And that, since he's actually military too, so we had both matched. So we're like, there's no risk. You know, what are we going to do? Not get matched?
Yeah, right. They can't take that back.
Like that contract's locked in, baby. So
time to be unprofessional.
Exactly. Yeah. So the first, I think, video I made, it was just me sitting in my office, and I was like that third-year med student or something. And I was just imitating like some of the most like heinous, terrible people I've had the displeasure of working with. You know, like the person who like you tell them you had a bad day on surgery, and they're like, how about the perfect opportunity to tell you how great my day is going? They're like, that's weird that they yelled at you in the vascular ORs. Like, I was invited to go on 3 research projects today, and the program director personally offered a letter of rec, and you're like, read the room, man.
We're supposed to be trauma bonding here. This is not. This is not. You're not doing it right.
Oh my God. Yeah, like I remember I had like a tough rotation on my ENT, and I was telling this girl, and she was like, that sucks. It's so weird because they all asked for my phone number after and told me how much they loved me. Like, in what world is that like comforting to anyone? So yeah, I was parroting a lot of that. And then Daniel had some ideas, and eventually we were like making a meme, and I wanted to create an OR set. So I put a tortilla over some like shoe boxes and then covered it with green towels. And it looked pretty close to a sterile field. And we were like, well, we can do something with this. So that was actually the first real skit, was us making like the nightmare OR scenario, where it's like all from Daniel's perspective, as he's like the med student. We used an ice cream scooper as a retractor and stuff. So I'm like slapping his hand and moving the retractor around. And like my girlfriend at the time, she's the scrub tech, and she's like getting in his face and like snapping, like telling him he's giving the needle back to her incorrectly. I'm like wiping my face, and then we're yelling at Daniel for breaking the sterile field, and we're asking him all like the worst pimping questions you can imagine. So like that was like a minute long, and I remember it just blew up like overnight. I think I probably had like 10,000 followers at the time, and then I think by the end of the next week I jumped to 20,000, and then like 25,000. So
like peak creativity especially with the prop, the makeshift props, which it was like just a whole part of that video, much less the dialogue and everything. The interactions is another thing, but just and then it just got more elaborate over time. I feel like.
Yeah, it's funny that you say that, because I was most proud of the dialogue. I was most proud of like the stuff I had picked out from these like nuanced moments, and I was like, the set is the set. But I remember all the comments were like, this is like, I didn't know we weren't in an OR. And I'm like, this is my kitchen. Like maybe it was harder for me to.
I wouldn't go that far. That like I could tell you were opening up a fridge from your house that you had somehow put on like a key code something on it. I don't know.
Yeah, we put a calculator on.
Yeah, that's what it was.
A calculator to the fridge.
So good. But it's just the creativity of it. But yeah, the dialogue is great, and so I don't know. I love this stuff. But then you So you talked about how you didn't have any, you could kind of feel like you could do whatever you wanted because you had matched. So exactly when did you get reported for professionalism? Was this in med
Uh-oh.
school
Yes, is in
or
med
was
school.
this in your intern year?
So this so we're turning our kitchen into the OR, right? And then I was like, Daniel, you know what's better than our kitchen? And he's like, what? I was like, the actual OR.
Oh, boy.
We were like, what if we go and film in the hospital OR? We walked around and we were like, this is the worst idea ever. We should definitely not do this. So our next best choice was, well, like, I wanted to do this series of what it was like to be on call with all the different residents. And the best backdrop for that was our med student workroom. I was like, oh, we can just kind of like mess around in there. It's in the hospital. We can use parts of it, but if we're careful, like no one will know it's UNC. And I think they clocked it was UNC in like the first video. I was like, oh, great. So I remember a lot of people like wanted me to do parodies. Like everybody loved the parody of medicine and of peds and of OB-GYN. They're like, do surgery, do ortho. And then when I did ortho, think about a week later, I get this. And it's funny because like I was like pretty scorched earth on ortho, I would say. Like I remember the do you guys cuss at all in this podcast or should I keep it like PG?
You say what you want.
can curse.
If it's an issue, we'll bleep it.
So like the opening line of the on call at the ortho resident is like he gets a page and he's like, Jesus fucking Christ, Tylenol, are you kidding me? And he's like shaking while he's holding the pager and he calls the nurse back like fidgeting with rage. And he walks and he's like, hey, it's Preston with ortho. And then so it's like that kind of like nuance. And there was a point where I was like, if he can't tolerate the solid, just give him a liquid version. And then I hang up. And for some reason that was mentioned in the professionalism violation. Like a ortho program director saw this video and was so like disaffected by it that he was time to find out who this kid is and like write to their med school. So I got an email from the like this like professionalism committee basically, and they said like, hey, like this message came in about your content. And then like they posted the message and it was like this person created like a very unprofessional picture of orthopedic surgeons, including like suggesting that they have poor rapport with nurses and that they are unsure of what different like swallow guidelines or like diet orders for something, which like every orthopedic surgeon is capable of knowing. And I was like, what? And so I was like, okay, well, I won't make fun of them outright. Yeah. So I met with this person and they were basically just like, hey, don't do it again. And I was like, okay, like, I think.
So this was just a random person
on the internet.
Random person on the internet who was an orthopedic surgeon who took offense.
Yeah.
And then set out to report to find you and report you.
Yeah.
That's a dedicated amount of hating right there. It's impressive.
Yeah.
He's like, I can neither confirm nor deny.
So what ended up happening?
So in all of my genius, I made a video about how it'd been reported, and I kind of just like, just laughed about it.
You two are meant for each other.
The thesis of that video was like, I didn't make it go viral, the internet did, and like, if it hurts, then maybe something's true, bro. Which is like,
did you bring that up as part of your defense?
Well.
Was that a part of your defense? I hope it was.
Yeah. So things returned to normal for a little while. And I had this idea. I was like, as long as I don't paint a specialty in a bad light, I think I'm okay. And I just made a couple more videos after that. And I was like, I think I realized that I just wanted to make fun of people for things they weren't self-conscious about. Because you would never make fun of an orthopedic surgeon for how well they do ortho surgery. They value that a lot. But if you make fun of them for how well they manage sodium, they don't care about they have no sense of value in that. So I'm like, I just have to make fun of things about people that they don't value. Like that's how you poke fun in general. Like the radiologist's social skills. I'm not going to criticize their ability to read a scan, but if they're awkward, like hell yeah, it's fair game.
Right.
So I was conscious of that, and I really wanted to do one for general surgery. And I had this idea that I was going to make it like this redemption arc for this person. I was really inspired by my chief resident when I was a med student, and we had like a rough start. I remember my first rotation ever was trauma surgery, and she came up to me and just like looked at me and was like, "Are you the med student?" I was like, "Yeah." And then she started walking away, and I was like, "Do I follow? Like, what do I like?" I just like took off after them, and I don't think we didn't like talk for probably the first whole half day, and then I asked her what to do in the OR, and she was just like, hold the retractor and look pretty. And I was like taken aback at first, and I realized it was like the best advice I could have gotten, because like a lot of other people like didn't know how to operate in the room. They didn't know how to like interact with people. But then like I was sitting there, I was just holding the retractor and like doing my best to look pretty. I did one of those well. And then someone was like, Preston, you did a great job today. And I was like, hell yeah. Like, I was like, let me cook. So me and this chief, like, we actually like started getting along pretty well towards the end of the rotation. And I remember I would like suggest something and she'd be like, no, that's wrong. It was like when we should transfuse or something, like what hemoglobin. And then I go back home the next day and I read a bunch of stuff, and I read the Trick trial, and I was like, oh, 7, hemoglobin of 7, we should transfuse. And I presented that the next day, and she would like smile and wink at me, and then we'd move on to the next thing. So like we kind of had this almost like rough banter where she would put pressure on me, be hard on me, but then I would rise to the occasion.
Mm-hmm.
And it was meaningful to me. So I wanted to capture that in this OR skit, this general surgery skit. So the skit starts out, you go in and this guy's like, he's ignoring you. He's being a dick around pages. He's handing you the page and then immediately snatching it back from you. But then the two of you go to a case together and there's like a complication, and then you go to the coffee shop and he opens up about how hard things are. And then it kind of ends. So I was like, I thought it was touching. And like at the beginning, you know, the guy's cussing a lot, he's acting unprofessional and things. And then he opens up towards the end of it. And I said in the skit, like I was like dedicated to Laura, my chief resident. And I meant it all like with good intent, and it was not received that way.
Oh no!
Like I think it was way too obvious that it was in
who it was,
like the hospital I was at. Yeah.
Uh-huh.
And so weirdly enough, there was a resident there that I'd never met, like a third-year resident who was also named Laura. And they just started, like, a bunch of people, I guess, started saying, like, is this about you? And, like, saying, like, oh, she must have been, like, awful, and she was getting bullied because of that. And then I guess she, like, reported that. And like, for this person, like, that would suck if someone thought they made a video about you and you're getting all this flack for it. Like, she doesn't deserve that. And I started feeling really bad that happened to her. But I didn't, like, know any of this stuff was happening because I was actually in Japan at the time on, like, my like, 4th-year vacation. So I'm in Tokyo, and I like check my phone and get an email, and it's like, respond immediately. Like, you've been found in like violation of a second professionalism thing, and like you have to go before this whole committee and stuff like that. And
second strike, you get the committee. Yeah. Okay.
Second strike. So apparently when she reported it, just a barrage of attendings just started like basically pounding down the door of the med student, of like the student faculty affairs office or something. It's like talking about like how like terrible I was and how unprofessional I was. And all
when
these
you
things.
when you got that second email, were you wearing a kimono at that time?
No.
Like, I'm just trying to get the picture.
I was eating ramen though.
Okay.
So just,
all right. Gotcha. All right. Anyway, continue.
Chopsticks in my left hand, phone in my right hand. Like,
that's gotta be a terrible feeling to get that like around, the entire world. So anyway.
Yeah, it was tough.
So you came back, and then you had to have your committee meeting.
So they were like, you can write an appeal, basically. Like basically they were like, you can write something to explain yourself. And I was like, okay. So I wrote this like essay, like literally analyzing my skit and how good it was. Like, it was really meant to like be positive. I was like, you can feel the angst in the general surgeon as he like uses, he like decorates his speech with these profanities, but then there's a change of heart at the climax when he like buys a cake pop for the student. And I have no idea how well that went. It probably didn't go very well, but funnily enough, there was this, the committee was going to be half faculty and half students. And she goes, the person in charge of this committee said, to protect your privacy, Preston, the committee that will be like deciding whether or not you get in trouble, like, the worst punishment was getting kicked out of medical school, and then it was like probation or something in the middle. They're like, we're going to protect your identity and make sure that there's no students on the committee.
Oh boy.
And I was like, I don't know if that's to protect my identity. I feel like you're just trying to like remove people that are sympathetic to me.
Exactly. That's what I would think too.
And I was like, oh, thank you. What a favor. And then I replied, I was like, you know what? My identity doesn't need much protection at this point. I was like, you can keep the students on. And so they were like, okay, you submitted your trial, and the hearing is going to be on match day. And I was like,
oh,
what?
God.
Jeez.
But you'd already matched, I guess. So
Yeah, I'd
so
already matched,
slightly
but
better, but
they didn't know
still,
that.
yeah.
Yeah. No, I'm trying to celebrate this with all my
but then
friends.
other students would maybe have to come in on match day
Yeah, to be
and
on
like
this committee.
testify either for
Yeah.
or against a fellow classmate. I don't know.
Yeah. So I was really stressed at the time. I removed all my videos that were like in the hospital. I edited things out that like even had my med school in the background.
Yeah.
I was just really scared. And I don't know, like it was easy to catastrophize. I think looking back, there probably wasn't a chance I would have been kicked out, but I was like, am I throwing my whole like career away for this? You know,
Mm.
because there's so many things that they post about how like if you use social media inappropriately in the hospital, like you will be like removed. I think when I was starting my surgery clerkship, the director told us a story about someone who like posted a picture like from their wards, and there was a patient in the background of the picture, and they were kicked out like pretty swiftly. So like don't do anything stupid in the hospital. So like those stories were floating around my head, and then it's like 2 weeks before match. It's like March 1st, and I hear a rumor from a third-year med student. She's like, "Hey, we just started our surgery clerkship, and like they were talking about you." And I was like, "What?" And I guess when they were doing orientation, the clerkship director goes, and don't you dare like talk about how your rotation is or your experiences on your rotation on your social media, because there was a student that decided to go and do that, and we're going after him. We really are. And I was like, yo.
Oh my goodness.
I was like, I'm like, is somebody else talking about their experience? So I hope that ain't me. But yeah, like that. So now I'm like stressed about all this stuff, and then I hear through the grapevine that the surgery department's going after me. They really are. I'm like, that's just like no bueno. So I reached out to like one of like the student counselors, and I told her all this stuff. I was like, hey, I'm not gonna lie, I'm pretty stressed. And so she met with me, and then she was like, out of all that stuff, agreed that having the trial on match day was probably not very fair.
Not a great
So they
thing.
moved it up a couple days.
Oh, that's nice.
And then yeah. And then they had the trial, and I wasn't allowed to be present for it, but I met with someone afterwards to
That
to
feels
relay the
wrong.
decision.
Why would
Yeah.
you not be able to be at your own trial?
I don't know, because it was like a committee discussion meeting or something.
Maybe it was it might have been a good decision so that Preston didn't self-incriminate
Well,
any,
true.
Probably
anymore.
Double
Probably
down
would've
on
made it
some
worse,
things.
honestly. Yeah.
And then what was the outcome?
So I met with this like attending afterwards who was like on the committee, and she like sighed, and she was like, there will be no punishment. And she was like, a lot of the attending and like senior faculty had many heavily weighted concerns, but the students were strongly opinionated about the outcome of this case. And I was like, let them cook, guys. Like,
That's awesome.
so
They came to your
I think like
rescue.
I feel like the students like really went to bat for me. And like there's something about the way this committee functions is that the attendings weren't allowed, or like the faculty didn't have more of a weight than the students did. Like everyone was seen as a peer. It was a democratic vote. So I really appreciated that. And I was like, wow, thanks guys.
There's a lot. Yeah, go ahead.
Yeah,
Sorry.
I won.
Yeah, you won.
So then I kept all my stuff removed. I was like, I'm not trying to get in trouble again at all. Like I just wanted to make it through till graduation. So I don't think I posted for like 2 months during this time. And all my hospital videos are down. And then as I like the day after I graduated, I think I re-uploaded or like unlocked all of my videos, and I'm back.
Yeah.
Except for the Gen Surge video and the ortho video. It's just
probably a
it's
wise
unpacked a lot of bad
decision.
memories. I finally put the Gen Surge one back up on YouTube, but maybe someday. But not right now.
It seems like there's this like generational divide. I mean, because we've run into this over the years with him too, similar things. And
I don't think I was ever taken in front of a
correct
committee.
But there is like
and
this
put on trial.
difference of opinion of what professionalism means among the older generation versus the younger generation. Like there's just different levels of acceptance.
I think there are some things though that even today, because I do think it's getting better. Actually, you know what? Let's take a break because there's some things I want to talk about with this. So we'll take a quick break. All right, we are back with Dr. Preston Roche, Press Row on TikTok. So Preston, you laid out kind of what happened to you in terms of this disciplinary hearing. And I think that there are certain things, and I talk about this a lot with my social media, like you make mistakes, right? And they're mistakes in hindsight. Like, okay, I probably shouldn't have said that. I've deleted videos, I've deleted tweets. Like I've had to edit things out, and it happens. But going to what Kristen was saying, this generational divide in terms of like, what does it mean to be professional in medicine? I think that definition is changing now with social media. It's getting more up to date, I should say, in terms of what it means to be a professional in the social media age. But I feel like there are still some things that are stricter than ever, like the hospital thing. Like not recording in a hospital, not doing, like, there's certain things that like people will take very seriously, and I don't see that changing.
And I think there's areas where we all agree, right? Like, clearly do not put patients in your videos and, things like that. So there's areas of commonality as well as areas of difference. But
yeah. They should have just given you a part of the hospital to just go to town.
I know. Why didn't
just
they?
Like, this is Preston's area.
My
He can make whatever content he wants. And I don't know. But
I've actually been looking at like abandoned hospitals around me. I'm just see if I can find some. I was like, what could I do here? There's a couple like
so you're
studios
gonna
in
add
LA.
trespassing to your list.
It's like wherever they filmed Scrubs, is that still around? I could probably do some good with that.
I got a question. If you had been kicked out of med school, what would have happened with your military scholarship?
Oh, they probably would have just assigned me somewhere in the military. So
yeah,
the stakes were high.
Yeah, I would be.
You would be
for
doing
9
something.
years or so. I would just be like plugging away as like a maintenance officer or something.
Yeah.
Wow.
Okay. Well, I'm glad that you're still with us here.
still kicking. Yeah.
And so psychiatry, this is what you have dedicated your career to in medicine. Many people probably wouldn't think, oh, well, this is a guy that wanted to do gym bro content and he's a psychiatrist. That's doesn't seem like they go well together. But tell us about why psychiatry for you.
So I was always interested in looking as prestigious as possible. I think ever since high school, I definitely had like a pretty insecure sense of self and always wanted to strive for whatever achievement would validate that. And so naturally, like med school was one of those things. And in this other part of my life, track was this place I could like prove myself. Track is very stratified. You can run faster. You can be the best version of yourself. And then you get like immediate feedback that you won the race.
What was your race?
Things like that. I was an 800-meter runner.
It's a long way. That's 2 times around the track.
Yeah. And it hurts a lot. I just got really good at turning left and being in pain. So I think that when I entered med school, actually, I still had a lot of these like philosophical or like mental health, psychiatric inclinations, but I refused to let myself entertain them because I was like, what is going to give me the most clout? Like I wanted notoriety subconsciously. So from my perspective, I was like, man, what are the odds that I'm interested in ENT, ortho, and derm? Like coincidence? They're nothing alike, but I like all of them equally. It's just the nares, they just speak to me. So I had this, I decided to pick ENT because I viewed like communication as like one of the most beautiful human things you can do. I had this like poetic build up to it. I'm like, words are like, they're like vehicles for thoughts and ideas to exchange between minds. And like, I can like repair someone's voice box and give them their humanity back. Like what's more beautiful than that? And then you go shadow in the OR and they're like doing a lymph node dissection. I'm like, this has nothing to do with humanity. Like we spend all this time like on the surgical anatomy. So I think I was having trouble reconciling that. And then I realized that I was just like, I was pretty miserable pursuing all of this stuff. I was trying to do research. I was stressing over everything. Like I would split hairs over grades and like stay up all night if I got a high pass instead of an honors. And I just felt all this pressure all the time and then realized that I wasn't looking forward to it. I think one time I sat down with a head and neck attending. We were like in an OR case that could have gone 30 minutes or it could have gone like 4 hours, depending on what like the biopsies showed from PAF, and ended up going like 6 hours. And by the time the fourth time we gone to pathology, he was like, honestly, man, like I thought it was going to get better after residency, but it didn't. And we were just like sitting there, like, it's like moment of silence, like waiting for the path results. And I was like, did you ever think about doing private practice instead of this? And he's like, how am I supposed to do that, man? He's like, I need an army of pathologists and oncologists to do what I do. And my student loans are like paying back any faster. And I'm just working all the time. I have a 12-hour case tomorrow. And I was like, wow, that's the light at the end of the tunnel, huh?
Yeah.
Yeah. Wow.
And I felt that like pretty profoundly. So weirdly enough,
those types of interactions just stick with you, right?
Yeah,
I mean, because especially when you're early on like that and you're trying to figure out what you want to do, like that's enough. Obviously, what you're probably about to tell us, that's enough to put you on a different path.
Yeah, it was. I mean, I think I had a lot of people dissuade me in other ways, but for some reason I listened then. And I actually wrote that quote on my whiteboard. I had like a whiteboard in my room, and I kind of look at it every day. Like, yeah. So
it should. I hope on that whiteboard it also says "Don't get fired." I think. I feel like you need that.
I forgot to put that. Actually, don't make unprofessional videos. Like, darn it. Yeah.
So it was. So you kind of turned off from surgery at that point.
Mm-hmm. I said, I'm miserable. I don't want to do anything. And then I said, like, well, what did I actually like? And I kind of went through all the patient interactions I ever had that like gave me meaning. And they were all like mental health related. So even though like on trauma surgery, the patients that spoke to me were someone who like had a suicide attempt, and it was talking to them about their depression, like after they'd woken up from surgery. Or if it was like on OB-GYN, there was someone who had come in with like postpartum depression. And I spent more time talking with them about like their relationship with themselves and what it means to take care of their kid than like going through their like bleeding risks and lactation and all these. Like I just found myself gravitating to that stuff. So I wrote down like the top 10 most like meaningful interactions I had, and I think 8 of them were psych related. And I was like, oh, this says something. And then I thought about my psych rotation. I really liked it. I was good at it. So like I remember the psych residents were like, you kind of have like a hankering for this. And I was like, shove it, buddy. I'm going to do ENT. I don't care. But then I thought back and I was like, oh, I guess I did like it a lot. You know, I really enjoyed interviewing with patients, and I had a bit of like an intuition for it. So I had all my sub-Is and rotations scheduled, and I just tore them up. And I went and like desperately asked the clerkship director for psych if I could meet with her. And I was like, I think I'm going to switch to psych. Is it too late? And she said that they get a lot of 12th hour applicants, but I'm an 11th hour applicant, so I'll be okay.
Oh.
Wow, so that's pretty common in psych to all of a sudden switch. And I mean, doing the military match, were there a lot of spots for that? Because I know in ophthalmology there's like very few, and so
very few. You mean one?
Right. I think that maybe there's one too. I don't know.
In the Air Force, there's one. Yeah.
Wow.
So what about for psych? Were you worried about that? Were you worried about the match?
I was stressed. So there were, I think, about 18 spots, and there were like 35 of us that applied, 36 of us that applied.
Oh.
So I was stressed going into it, definitely. We do these 2 away rotations, and they're all like basically like your high stakes tryout. So I just try to channel like everything I knew that makes you successful. I was like, just be a homie, like support the vibes of the team. Things will be okay. And I remember my first day of the rotation, I showed up and we like sit down for didactics, and there's like 8 dudes in the room and 6 of them had mustaches. And I was like, I know exactly what I'm going to be doing for the next 4 weeks. I grew a mustache.
Yeah.
And then like every time I went on like an individual rotation after that, I'd like walk into the consult's room and they'd be like, nice mustache, bro. I'm like, yeah, no. So that's actually the genesis of the mustache, was me trying to hack my military rotations. And then I come back from them, and my girlfriend was like, I actually kind of like that mustache. Like, you're not allowed to shave it. And I was like, all right, I guess this thing's going to stick.
Well, now you don't have it right now. So
I don't. Yeah.
What's the deal? Yeah.
We broke up.
I did notice he said my girlfriend at the time a little earlier. So usually that's a hint.
All right. So you are now, a full year into, I don't know, in your intern year, how many of those months were psychiatry related education?
6. It's about half. We do like a half prelim year.
All right. So you obviously know a whole lot at this point of psychiatry.
Yeah, whole lot of nothing.
So I thought what we could do is I have created all these characters in medicine through my content. And I thought it'd be fun to have someone with a psychiatry background psychoanalyze some of them. So we've done this once before. As a while back, we had a psychiatrist on the podcast who did a few of the characters. So I'm choosing different characters today. And so the first one I want to do is actually goes from a conversation Kristen and I had together. She was trying to have me just explain, like, what is the surgery anesthesia? Like you make all these videos about surgery and anesthesia. They seem to like hate each other, but one maybe like doesn't like the other more than the other doesn't like, what is going on there? And I actually had a hard time trying
I was asking about like personality type of an anesthesiologist. Like what kind of person is drawn to anesthesia other than for the work-life balance?
And I found myself like, I know kind of in my head, I couldn't get the words out very well. So I was hoping that you could provide some insight to us, to Kristen, to our listeners about the kind of the dynamic there.
Yeah, of course. So I was thinking, actually, I was watching, to prepare myself for this, I was watching a lot of your anesthesia surgery videos, and I noticed like a common trend, which is that anesthesia kind of plays these two positions. One where they're like intimately involved in the case. I think you called it like your drape glare, the drape stare.
The drape glare, yeah.
They're very close, but then they can pivot and protect themselves and hide behind the drape and go like full Sudoku mode.
Yes.
So when I was thinking about that style of attachment, I stumbled upon this thing called fearful avoidant attachment. So anxious attachment is where you really need to be close to someone and always be reassured and supported by them. And then avoidant is where you don't want to be dependent on anyone else and you stay away. And then very rarely people will have a little bit of both inside of them. And that's what I see in the anesthesiologist. So they crave intimacy, but they fear being vulnerable. So they want to see what's going on in the surgery. They get close to it, but they're afraid of letting themselves be observed or be perceived.
Oh, I see.
So they can maintain that distance behind the drape. And then the surgeon is something I would call dismissive avoidant, which is just like fully just like not letting anyone else be involved or be dependent on other people. So actually in this book, it describes the dynamic between the fearful avoidant and the dismissive avoidant. So I'm going to try to read this excerpt and see if this resonates with you guys.
What is the book? What is this from?
It's called Attachment Theory.
Okay. All right. Let's hear it.
Right. And I have not read this, so this is me just ad-libbing it. Okay. The fearful avoidant and the dismissive avoidant, so the anesthesiologist and the surgeon, will likely have a difficult relationship. The dismissive avoidant will provide the intense emotional fulfillment that the fearful avoidant looks for. This can lead to the fearful avoidant feeling rejected and withdrawing over time, creating more distance in the relationship. Moreover, the surgeon will likely feel overwhelmed by the anesthesiologist's strong presence. I don't know if that fits too well, or maybe you can feel it through the curtain. This could cause frustration for both parties and emotional chaos in the relationship. However, the surgeon will not respond to the anesthesiologist with an outburst of emotion, something that would be especially triggering for the anesthesiologist in a sense. This would introduce stability into the relationship to which the surgeon is unaccustomed. This would be a high for the relationship in the absence of a feeling of an unsafe environment. So there's a low lack of emotional connection, and long-term, it's meant to be unsustainable.
Oh, perfect.
Which kind of makes sense.
It does.
The nice thing about attachment, though, is you can change your attachment style. So there's hope for both of them.
Oh, good.
It's a redemptive arc.
I need that book. I feel like I could really get into the, play into the attachment styles.
I mean, I
like
have
that.
all my personality textbooks still from school.
All right. How about, I'm dying to know what you think about my psychiatrist character.
Oh, so I may have just projected a lot of my opinions about psychiatry on him. But so one thing that struck me about him is the consistent theme of appearance. I think the first time the med student comes in, he's like, "Are you wearing houndstooth? Do you have tweed? Elbow patches? This won't do." And then even when he visits the rural community center, for example, he's likened to a preacher. And he's like, "Do I look like a preacher?" And he like is exasperated, responds to people's observations of his appearance. And I think that's more emphasized in the psychiatrist than like any of the other specialties, and I saw it as like an appeal for legitimacy, almost as if like he can construct this costume in a way he leans into the fact that he's a psychiatrist and embraces that he's a real doctor, that he truly wants to be a psychiatrist. So I imagine he has some probably ambivalence about being a psychiatrist, and maybe a little bit of shame or sense of instability, but because he's a psychiatrist, he probably doesn't feel like that's okay. So I imagine that he has a lot of issues with self-compassion, and a way of kind of brute forcing through that self-compassion is by just owning the fact that he's a psychiatrist and just going full decked out with a tweed. Because when he looks in the mirror, he's stating to himself, you're a psychiatrist and nothing else. You need to own this despite whatever doubt you have on the inside. So that's I guess what I think about him.
Wow. What do you think about that?
I'm afraid that people are going to be like, well, what does this say about the person who created these characters?
That's what I want to know.
Because who is really being psychoanalyzed right now? Oh, okay. Fascinating.
What are your thoughts on the ophthalmologist?
Well, how about emergency medicine?
Oh, so EM was interesting to me. So there two things kind of came to mind. The first is everyone talks about ADHD and the EM personality. And I was like kind of struggled with that a little bit, because I was like, if you have an issue with like impulsivity and inattention, being in a scenario where you're juggling a million tennis balls sounds like my worst nightmare. So I was like, why would people be drawn to it? And then I kind of realized that they may be good at it because they've been training for it their whole lives. If every moment of every day is chaos, when you step into the emergency room, you've already built up several coping skills to work with what's in front of you. So it's like, everyone's like, how can you be in the emergency department? It's like so chaotic compared to the rest of my life. And they're like, honestly, it feels the same. I actually don't notice a difference. And so like that made a lot of sense to me, I guess, kind of coming from where this eclectic person they're rock climbing, they're biking, I think he said he rock climbs to work at some point, and jumping around to all these different places, working in between these different specialties. That made a lot of sense to me. The other thing that was fascinating was the "I love you, bro" exchange between him and the ortho bro.
Oh yeah.
I think he asked the ortho bro if he could come help him out because he had a couple femurs and radiuses that needed reduction. And then he said, "Thank you, love you, bye." And this caught the ortho bro by surprise. And then this was really fascinating to me, because I'm like, why does he have this subconscious sense of connection, or being like this need to be saved or rescued by these specialists? And I thought about how if you're in emergency medicine, you're often like pretty unsung. My sister is an EM resident, and I feel like a lot of times in the hospital, it's a thankless job, because when you do everything right, when you discharge the patient that didn't need to be seen by a specialist, we don't hear from it. But when the specialist gets annoyed, it's like the one patient that you're like, I didn't know. Guess I have to call psych. Guess I have to call ortho. And then they're always just kind of talking to you like you're stupid. Like they're constantly being treated by all the specialists in the hospital like they are less than. Right. So it could probably do a lot for your sense of worth and your sense of self, and the need to be really supported by others. So I was like, wait, him and ortho have this relationship where ortho comes in and rescues him, like provides him with this support. And then in exchange, he gives ortho praise, which is what ortho needs. So they have this like lovely dynamic where ortho's like, you won't be abandoned in emergency medicine. Like, I shall come in and help you out. And then in exchange, he's like, I love you for this. And I shall praise you, which I don't think matters too much to ortho. I think it matters to Gen Surge, because I was really trying to understand ortho, and all I got out of it was that he just really likes bones. I don't know what to do with that.
I think ortho's a sweetheart.
I think ortho really likes people and bones. Yeah.
He likes people. He's honest, but also I feel like there's also an element of weaponized incompetence going on a little bit with ortho.
Where'd that idea come from?
What? I don't know where that came from. I have no idea. But because in another video I have, he admits he's trying to admit a patient to medicine, and medicine says no, and then he starts talking about what kind of things he's going to do during the admission.
Yeah, like he like threatens his incompetence.
Threatens his incompetence, right? And then medicine eventually agrees. And so I think there's a little bit of that as well. He does, because ortho, to others, he might come across as not very smart, but he's actually brilliant.
Right.
He's actually maybe one of the smartest doctors in the hospital.
He's very smart in what he does.
He knows how to get what he wants.
Right.
All right.
A little bit secretly manipulative.
Just a little bit. Just a tiny bit.
Yeah.
But anyway.
Sometimes the smartest thing you can do is not let people know you're smart.
That's
a good point. I also want to point out that I gave Preston like 45 minutes to like figure
these things out.
I texted you just 45 minutes ago and I was like, can you psychoanalyze these characters? He was like, on it. And I am simultaneously impressed and somewhat alarmed by how well you did that.
Okay.
Because again, I was the one that made these characters. And so
I guarantee you he didn't put nearly as much thought into it as you just did when he made them.
Probably.
And yet you're accurate.
Probably. Oh man. All right. So what's after residency? What's happening next for you?
You got
3 more years, right?
Look, hold on. Slow your roll.
What?
He's like, you're PGY2?
Yeah.
Just freshly PGY2? There is no after residency yet.
No, I guess
when you're freshly PGY2.
True, but mostly in terms of the military thing.
Okay.
Like what happens?
So, the first question is fellowship or no fellowship. And if I were to do one, I'm interested in either child or maybe like neuropsychiatry. Neuropsych's a little bit more niche. I don't know if that would happen, but child's pretty interesting to me. I think I care a lot about things like ADHD, bipolar, eating disorders. I like the interplay, both like socially and biologically, and that happens to align with a lot of like child populations. And the other thing that I found I get a lot of value out of is setting someone up to be successful for the rest of their life. That gives me a ton of meaning. And I think the more rest of their life someone has in front of them, I think the more of a potential I feel I have to help them. And I talked to some people who they like Jerry, and they're like, it gives me a lot of meaning to make someone's final moments the best they can be. And I think that resonates with me strongly, and I can understand it. And then also I can take a look at myself and say, I care a lot about like setting you up for potential. And it becomes harder in these older patients that there's not a lot of potential for change or growth after that, even though you can optimize the moment. So, I mean, I don't have to do a fellowship to treat kids, but I imagine I might, just because I like this attachment theory stuff. I care a lot about how like we develop and grow as people, and I need to unpack all my own trauma with my my parents. So I could go to therapy, or I could just continue to like do more fellowships and see if I can figure my own stuff out.
And then after a fellowship, then you're doing some kind of active duty, something.
Yeah, so I'll be active duty anywhere in the world. One thing that's nice about child in the military is that they see you as like a one-stop shop for everyone. They're like, you can treat adults and kids. So a lot of those specialists have more opportunities to go to overseas bases, which I see that as an appeal. I guess it could be cool to work somewhere like Japan or Italy or England as a part of the Air Force. And then I think get a chance to, for me, that's valuable because psychiatry is practiced so differently in other parts of the world. And I struggle a lot with how carceral our system is. So I really kind of want the chance to see how England approaches their psych wards or how Japan approaches them. We all have the same problems. Just about every country, 1% of the population has schizophrenia, but we have totally different approaches. Like even Japan, their approach to ADHD is very like behavioral and disciplinary. They don't allow Adderall at all. They have completely outlawed stimulants.
Oh, interesting.
Whereas like on the other hand, like the US is very stimulant heavy with those kinds of things. So that kind of interplay is fascinating to me. And I hope to use the Air Force to dive into that a little bit because I don't know what other contexts I'll get the chance to practice in another country like that.
Yeah.
Right.
Huh. Well, I think, but Kristen's right. For the next few years, your only job is to not get fired. Okay. So I feel like you got a get out of jail free card already. And so don't waste that, Preston, please. We need you. in healthcare, in medicine. And tell us about an upcoming project. You've talked about a little bit on your platform. You got a podcast that you're working on.
Yeah. So this is actually my first time being a guest on a podcast, which is a good trial run for me, but I'll be hosting my own soon.
You're doing great.
Thank you. Our plan is to call it How to Be Patient. And the idea is taking all of the aspects I have of my life as a psychiatrist, both as like a biological scientist, as a therapist, as someone who interacts with patients, and then kind of take those three things and explore all the stories of it. So one part of the pod will be interviewing patients and kind of getting to show people the context of how medications affect us, because a lot of people hear this one-off story of their friend that took an SSRI and they're like, they didn't work for them. And then someone else is like, well, they worked for my friend. And the answer is it's both. So this is a chance for us to get all those stories in one spot so you can really see what the context is and how it applies to you. And then the rest of the pod will be us kind of doing these deep dives into the way psychiatry interacts with the world, like social media. So I have a unique perspective where I'm pretty in touch with social media and a lot of like Gen Z and millennial things, but also I have a perspective of a psychiatrist. We had this didactic course where it was like social media and medicine. And I felt like the doctors that were teaching that were so out of touch with what actually happened on TikTok that it was hard to have like a meaningful engagement with them. So I think this other part of it will be taking our perspectives and talking about how things like OCD, ADHD, multiple personality disorder manifest in the world and kind of change. So our plan is to do like different deep dives on topics like that.
Yeah, I'm excited about it. And
very cool.
It's fun to also, our whole human content team is kind of helping you with this, and we're excited to work together with you. And so that's the other thing I wanted to let people know about. We're getting to do some collaboration with it.
I feel like I've been adopted by the human content family.
Well, I told Kristen, I was like, listen, look at this. This guy's got amazing content. He's well-spoken. It's an interesting field, psychiatry. Mm-hmm. Like, he knows what he's doing on social media. At the time, I didn't know you had almost gotten fired. The assessment still stands though, but
okay.
And so I was like, we got to figure out, some podcasting. I think you'd be really good with the podcast. And then brought it up with you, and you just ran with it and came up with some awesome ideas. And so we're excited to see where it goes.
Yeah, thank you. Well, those are such kind words, and I'm excited to talk about it. I think you were probably the most middle person to mention the podcast to me. I had a couple commenters that were like, I'm gonna be honest, dude, I just put this on in the kitchen while I cook and I just listen to you talk. I feel like you should maybe consider podcasting. And I was like, seed planted.
Yep.
And then you messaged me and I was like, okay, like this is really validating. And then once I announced it, we've been getting a lot of positive feedback. So I'm excited to see where it goes.
Awesome.
Yeah. And you also have a nonprofit.
Yes. So it's called Propagations. We just recently started it. And the whole idea is to get more resources to make the psych ward experience for patients a lot better, because right now it sucks. Basically, a lot of the patients I have, they don't have access to music. They don't have access to headphones. It's like VHS tapes from the 90s. And we're trying to get products from companies to revamp these wards and just make things better for them. And the way it started actually was the company Bose put out a video that I felt was a little out of touch, and I kind of called them out on it, making fun of people with mental health. And then they made great reparations. They apologized, said we really don't know what we're doing. We got together, and they said, how can we make this up, to the community? And I was like, why don't you donate some headphones to these like psychiatric hospitals? And we actually got a list of like 100 hospitals. We picked like 15 that really resonated, and then they sent out their like Bose Quiet Comfort headphones to the individual wards. And so now across the country, there's like all these different places that now have like brand new like Bose equipment, either like the like Beats pill things or like the Bose pill boxes or their noise canceling headphones, which is, it's pretty cool to see that I could do that. And we're trying to apply it to everything now. So like clothes, toiletries, board games, stuff like that.
Very cool.
Oh, that's awesome. Yeah, keep that good work up.
Yeah, and if people want to help you, how can they do that?
Oh, yeah. So if we're working on our website, but if you want to reach out, you can just email us at inquire@propagations.org. we're kind of in the process of collecting funds and like finding partners to work with right now. So all the work I'm doing is like finalizing my pitch to like potential partners and donors so we can kind of explain to them like, why should you give 500 pairs of underwear to this random nonprofit that plans on distributing them to hospitals across the country? That's kind of like the stage we're in right now. Yeah. And also if you're interested in donating your time or you like to paint murals or art, things like that, we definitely have a lot of space to employ people like that around. Art lasts a long time in psych wards and makes a huge difference for people. It's something that's definitely lacking.
Yeah.
That's great.
Sure. So inquire at propagations.org.
All right. Check it out. Well, Preston, always good talking to you.
Yeah. Well, it's great talking to y'all.
See some great things from you in the future.
No pressure.
It's coming up. Yeah.
Okay.
Exactly.
I'm on it.
All right. Take care.
All right. Bye.
Hey, Kristen.
Yeah.
Would you rather have like 1,000 Demodex mites on your eyelid or just one of these little guys?
I will have one of those, please.
Because they're so cute?
Yeah.
Yeah, look at them, little eyes, and they got their feet, and they're just
They're
kind of
soft,
just crawling all over your body.
Are there really 1,000 Demodex mites on eyelids?
Oh, I don't know. Probably not that many.
Okay.
But they can be numerous.
Yeah.
And they can cause Demodex blepharitis.
Yeah, I don't think I want that.
Yeah, you get like red, itchy, irritated eyelids, flakiness, crustiness. Yeah, they can cause some itching.
No fun.
Yeah, it's not real fun. But you shouldn't get grossed out by it. I can look at your face and tell you're a little grossed out by this.
I don't want that.
Don't get grossed out. Don't get freaked out. Get checked out.
Okay.
All right. To find out more, go to eyelidcheck.com. Again, that's EYELID check.com to get more information about these little guys and Demodex blepharitis. Love that guy.
Yeah,
big fan.
He reminds me of you. So it's no wonder that you like him.
I like fun medical content. We need good, high quality content creators that aren't slimy, right? That aren't trying to just like sell a bunch of stuff.
Exactly.
That's bad, like supplements and all the nonsense out there. There's a lot of bad stuff out there. So it's like
a lot of grifters.
It just feels refreshing to hear a medical content creator that's like,
excited about it.
Excited, yeah, just in it for the content.
Right. Yeah, and very creative and smart and well spoken.
So looking forward to seeing. He's been working hard on this podcast, and so I'm excited to see how it turns out. I'm sure it's going to be great. So let us know what you guys thought of the episode. Do you have any guests that you want us to invite on and talk to? Any medical creators or any non-medical creators? Occasionally we can convince someone who's not in medicine at all to come on a medical show.
That's true.
I feel like maybe they might be a little intimidated by it.
Yeah, or maybe someone tricked them.
Or just like, why on earth would you want me, a non-medical person, on a medical podcast? So sometimes we have to like figure out why it would make sense, but we always do.
Yeah. Everyone has a connection to the healthcare system.
How do you not have a connection to medicine in some way? All right, lots of ways to hit us up. You can email us, knockknockhigh@human-content.com. Visit us on our social media platforms. Hang out with us and our Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thank you to all the wonderful listeners leaving feedback and reviews. We love seeing those reviews. If you subscribe and comment on your favorite podcasting app, we're on YouTube. We have a YouTube channel, new one, at Glockenfleckens. We can give you a shout out. Like at user JV, bunch of numbers and letters. On YouTube said, I hope Milo is enjoying the new house. Well,
he is enjoying it. It took a while to warm up to it because he had to learn it.
Because he's
like see it very
kind
well.
Of blind. He does not see very well, and so it did. He's stumbled over a few steps here and there, but he's got it down now.
He knows where things are, and
he's not totally
having
blind.
fun.
He can get by. Thank you for asking. Full video episodes are up every week on our YouTube channel at Glockenfleckens. We also have a Patreon. Lots of cool perks, bonus episodes where we react to medical shows and movies. Hang out with other members of the Knock Knock High community. We're there and active in it and doing things. Early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glockenflecken or go to Glockenflecken.com. Speaking of Patreon community perks, new member shout out to Lou S. Lou, Thank you for joining us. Thank you for joining our little community. We'll have a job for you shortly. Shout out to all the Jonathans, as usual. Patrick, LaCSE, Sharon S., Omer, Edward K., Stephen G., Jonathan F., Marion W., Mr. Grandetti, Caitlin C. Brianna, LKL, Keith G., JJH, Derek, and Mary H., Susanna F., Jenny J.
There you go.
Muhammad K., Aviga Parker, Ryan, Muhammad L., David H., Jack K., David H. again, Gabe, Gary M., Eric B., Medical Meg, Bubbly Salt, and Pink Macho. Patreon roulette time. Random shout out to someone on the emergency medicine tier. Sally. That's Shally.
Shally. It's a shout out to Shally.
Thank you for being a patron. And thank you all for listening. We're your hosts, Will and Kristen Flannery, also known as the Glockenfleckens. Special thanks to our guest, Dr. Preston Roche. Our executive producers are Will Flannery, Kristen Flannery, and Courtney, Rob Goldman, and Shanti Brick. Editor and engineer Jason Portizo. Our music is by Omer Vince V.
Deep breath.
To learn about our Knock Knock High's program disclaimer, ethics policy, submission, verification, and licensing terms, HIPAA release terms as well. We got those in there too. You can go to glockenflecken.com. Actually, I don't know if I've ever seen it on our website. Is it on there? Are you sure? Okay. All right.
Just don't worry your pretty little head about it.
I should be more familiar with our website. Or reach out to us at knockknockhigh@human-content.com with any questions, concerns, or fun medical puns or limericks or jokes if you have them. Knock Knock High is a human content production.
Knock, knock. Goodbye.
Hey, Kristen, you know what I had to spend a lot of time doing yesterday after work?
What?
Clinical documentation.
Womp, womp.
It's terrible. Like not only just patient charts, like prior authorization paperwork, that paperwork that you don't even know that there was paperwork for. I mean, it's just there's
a lot of documenting.
So much documentation. You know, I really could have used
what?
The DAX Copilot from Microsoft.
That would have helped.
It would have just taken so much more off my plate. Honestly, can I give you some stats? This is pretty impressive. Yes. 90% of patients say their physician spends less time on a computer when they use DAX Copilot.
I believe that.
All right. Furthermore, I got more. 80% of physicians who use DAX Copilot say it reduces cognitive burden.
It's always good for you to think less hard.
Oh, man. I want to... No. Okay, I'm preserving my thinking for the more important things. And 62% of physicians say they are less likely to leave medicine or their organization.
That seems important.
It is very important. To learn more about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit aka.ms/knockknockhigh. That's aka.ms/knockknockhigh. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.